The heart is often called nature's perfect machine. But what happens when this incredible organ develops in a completely different location? Today, we're exploring how a simple shift in cardiac position can turn routine medical procedures into complex life or death scenarios.
That's fascinating to consider, especially with conditions like dextrocardia, where the heart develops on the right side instead of the left. How do medical professionals handle such cases?
Well, here's something mind blowing. Dextrocardia occurs in about 1 in 12,000 live births. When you do the math, that means thousands of people worldwide have their hearts on the opposite side of their chest.
So that must create some serious challenges for emergency responders and surgical teams.
Exactly right. Even basic procedures become incredibly complex. Imagine trying to do CPR or place ECG leads when everything is reversed. Medical teams have to essentially mirror all their standard procedures, or they risk getting completely inaccurate readings.
Let's dive deeper into the heart structure. How do all these layers work together?
Picture the heart like a three-layered fortress. You've got the epicardium on the outside acting as a protective shield, then the myocardium. That's the powerhouse muscle doing all the pumping, and finally the endocardium lining the inside. Each layer has to function perfectly for the whole system to work.
That makes me think about how this affects surgical procedures. What happens when one of these layers is compromised?
Well, that's where things get interesting. Take someone with a weakened myocardium from heart disease. Surgeons have to completely rethink their approach. They need special anesthetic combinations that won't strain the heart further, and they have to monitor cardiac output constantly.
Hmm. What about the chambers? How do they maintain proper circulation?
Think of it like two synchronized pumps working in perfect harmony. The right side handles deoxygenated blood, while the left side manages oxygen-rich blood. During surgery, maintaining this balance is crucial. Even small disruptions can cascade into major problems.
That must require incredibly precise monitoring during procedures.
You know what's fascinating? During mitral valve repair, surgeons have to watch pulmonary pressures like hawks. If those pressures rise too high, it can trigger left-sided heart failure almost immediately. It's like a high-stakes balancing act.
Speaking of valves, could you explain how they function as gatekeepers?
Picture four sophisticated one-way doors: the tricuspid, pulmonary, mitral, and aortic valves. Each one has to open and close at exactly the right millisecond. When any valve malfunctions, it's like having a leak in a complex plumbing system. The whole circulation can get backed up.
That's incredible how precisely timed everything needs to be.
And here's what makes it even more amazing. The heart's electrical system coordinates all this timing. The sinoatrial node, nature's pacemaker, generates electrical impulses that spread through the heart like a perfectly choreographed dance.
How does this electrical system affect medical procedures?
Well, during surgery, anything that disrupts this electrical symphony can cause serious problems. That's why monitoring heart rhythm is crucial. Medical teams use various medications to maintain stable cardiac function, but they have to be incredibly careful not to disturb the heart's natural pacemaker.
Let's talk about the coronary circulation. How does the heart feed itself?
Picture a crown of blood vessels sitting atop the heart. These coronary arteries branch off from the aorta and wrap around the heart muscle like ivy on a wall. Any blockage in these vessels can trigger a heart attack, which is why maintaining healthy coronary circulation is so vital.
That shows how interconnected everything is in cardiac anatomy.
Exactly. It's like a complex domino effect. A problem in one area inevitably affects others. That's why modern imaging technology is so crucial before any cardiac procedure. Medical teams need detailed 3D maps showing not just structure, but blood flow patterns and tissue health.
How has this understanding changed medical procedures over time?
Well, consider this. 50 years ago, many cardiac procedures we do routinely today were considered impossible. Now, with our deep understanding of cardiac anatomy and advanced imaging, surgeons can repair hearts while they're still beating. It's truly remarkable how far we've come.
That's such an incredible evolution in medical science.
And we're still learning new things about this amazing organ every day. From the protective pericardium to the precise timing of valve function, Every part of the heart plays a crucial role in keeping us alive. Beat after beat, moment